go ahead. Christine, I believe you're starting. Is that right?
Yes, let me share my screen. All right, everyone can see my screen?
Yep.
Excellent.
Yes.
So good afternoon, everyone. My name is Christine Golden, and I am with the Revenue Cycle Management Division. This is my 18th year at ECW. And everyone can mute themselves.
Yeah, someone needs to mute, please.
Dr. Mehta.
All right. So this afternoon, we're going to talk about CodeCorrect. So what is CodeCorrect and Knowledge Source Pro? So CodeCorrect is a service that
Oh, great. I muted. Sorry, go ahead.
Okay. So
I had to figure out who it was. Go ahead.
So CodeCorrect is a service that provides a real-time review of claims and checks them against Medicare CCI edits. This can help minimize chances of claims being rejected because you can see these edits within your claim screen. Something to understand, this is a third-party product. It is owned by FinThrive and integrated into eClinicalWorks. So there are two options available for CodeCorrect. The integrated code check, which we will review this afternoon, and Knowledge Source Pro, which gives you access to the Knowledge Source website that provides additional information on some coding requirements, modifiers, things like that. So the first piece of this is the integrated code check. This is the most popular product that customers choose. So again, this is based on Medicare CCI edits, which most other payers tend to follow. So it will let you know if the modifiers are appropriate, if your codes are valid or invalid, if there is medical necessity verification, all of those types of situations. So the first piece of this is the configuration. ECW will set this up with the credentials that we receive once you have signed up with the vendor. We'll then go through a list of edits where you can choose which edits you would like to ignore. And these edits are available for both HCFA 1500 claims and UB claims. You can also choose which insurances you want CodeCorrect to perform this validation on. It does check Medicare by default, but you also have the ability to have it apply to all insurances, only certain insurances, or all and just exclude a few. So we're going to look at what these errors look like within your claim, the CodeCorrect viewer, and the legend that is within that viewer to explain what it is exactly that you're looking at. So within the claim itself, on the errors tab, so just like any other errors in your ECW system, If there are CodeCorrect errors, the error tab will turn red. And you can see that these are identified by CodeCorrect error. So if you have claim edit rules created in your system, each of these different types of errors are identified, right? One will have a rule number. CodeCorrect will show CodeCorrect error. Your clearinghouse errors are prefaced with the clearinghouse name. At the bottom of that screen, you'll have this additional CodeCorrect button. When you click on the CodeCorrect button, it will show you each CPT code, the diagnosis codes that are linked to that CPT, as well as any modifiers on each CPT line. Now you can see also at the bottom of the screen here, where you can click to see the legend. All right, and this is especially helpful when you're first starting out with CodeCorrect. So it's very simple, right? Like a traffic light. You know, if it's red, right, it's a stop, check it, something is wrong. Yellow, it may be okay, may require a modifier. Now keep in mind that if it does indicate that a modifier is allowed, CodeCorrect will not supply the modifier, but in some cases it will give you a list of modifiers that may be approved with that CPT code. The second piece of this is the Knowledge Source Pro. This is an add-on service, and what it does is within that screen, any of those codes that are blue and underlined are hyperlinks. So you can click on the CPT, the modifiers, the ICD, right? And it will take you to the website and give additional information related to the particular code. So this is just a screenshot of the type of information that is available. So this is for the specific code, the R05, which in the claim screen, right, the error showed as it may need additional digits in the diagnosis code. So let's take a look at this within the product itself. So I'm going to go to my claim screen. Actually, you know what? I'm going to just put in my claim number here. And here, let me make sure I have the right claim there. Okay. So here we can see, right, the error tab turned red. When I expand my screen here, I can see that there are specific CodeCorrect errors.
I'm gonna stop you for a second. I see demo.
Just the
I see.
product demos.
Yeah. Just a slide that says product demo. Sorry.
Oh, okay.
Right.
Let me change the screen. Look. And let me see, how do I change my screen? New share. There we go.
Now we're cooking.
All
There
right,
we
now
go.
we can see?
Yeah.
All right, awesome. Yes, I'm not used to Zoom, so I'm used to meeting that follows my screen when I switch. So in the claim here, we can see the error tab is red. All right, so when I expand this, we can see the ones that are indicated as CodeCorrect errors, right, with an explanation, right? So in this case, it's saying that the 99213 is a component of 36478, right? But a modifier is allowed. So if I click on the CodeCorrect button at the bottom here, here's my CPT codes. When you hover over it, you can see the description. The M here, if you click on this, it will give you a list of, well, in this case, for the second line item, right? Because this is green. If we click on the M here, it will give us a list of potential modifiers. Same thing with our ICD codes. If you hover over it, you can see the description. And then down at the bottom, it gives you what the coding issues are for those particular codes. Now, if you have the Knowledge Source Pro, you can click on any of these hyperlinks. Now, unfortunately, there's an issue with my internet here, so it's not displaying the information. But here, this screen would open, like we saw earlier, and give you information about that code. If you click on the M, it will automatically open to the screen with the list of modifiers, right? Same for CPT, same for ICD codes. Once these issues are resolved, right? So let's say that you go and you add a modifier to the 99213, then the CodeCorrect errors will go away. So let me take you back to the configuration. So under your main menu and your billing tab and claim edits, here you'll see the CodeCorrect edits and the insurance configuration. Under the CodeCorrect edits, this is where you would select to automatically check. If you don't want the system to automatically check the errors, right, and your billing team wants to just check it maybe when they're in doubt about something, you'll still have that CodeCorrect button within the claim, which you can click on and it will run the validation. If you select this, when the claim gets created, that validation is automatically done. The list here is edits that you want to ignore, right? Some of the most popular ones is, to ignore if there is no local medical review policy, right? I don't really need to know if nothing applies. So that's probably one of the most commonly selected in this. But if there are any others, you can just select the ones you choose to ignore. And again, we have these options both for your professional and for UB claims. If we go into the insurance configuration, this is where you can choose, do you want to apply this to all payers? Do you want to apply, excuse me, to all except certain payers, or just for specific payers? When you click add, it will give you your insurance list. And you can see down here that it mentions that Medicare claims are checked by default. The last option in there is the configuration screen. This is not an area that you would need to go into once ECW has configured this for you, but this is where your credentials are stored. So, if there are any issues, this is where our technical team would need to go. So the integrated portion of it is very straightforward, right? It will, if it sees any type of conflict with the CPT codes itself, CPT ICD combinations, all of that information will be available right here within your claim screen. Right. Any questions?
I don't see any in the chat. Usually people are good at throwing them in there. Anybody want to come off mute and ask a question?
I have a question. This is Rachel from Children First. So the CodeCorrect errors, does it take into account the different insurance rules? Like if United requires a specific modifier on a code that maybe CareFirst does not?
It does not. They are not insurance or payer specific. They are based on the Medicare CCI edits.
Okay.
So, if you have a situation like that, my suggestion would be to create a claim edit rule to make sure that, those claims don't go out without being corrected.
Thank you.
You're welcome. Anyone else?
Doesn't look like it.
All right. And the slide deck will be available.
Oh, great. Okay.
All right. So I will hand it back over to who do we have? I think Drew had to drop off.
Yeah.
All right. Thank you, Christine.
Thanks so much, Christine. It's Nitesh here. Go ahead, Julie.
Thanks, Christine. It was nice to meet you. Go ahead,
Well.
Nitish. Sorry.
No problem, Julie. So I was just trying to ask, Anirudh, is there anything you're presenting today?
Correct. Yes, I'll be presenting my screen now. Just give me 1 second.
Thank you.
Sure, no problem. Please let me know once you can see my screen.
We can. All good.
Okay. So as you guys might know, today we'll go over patient portal enhancements. So we'll just discuss what are all the new things that are coming in soon and the things that are already in place. So as you guys might know, the patient portal is a tool for the patient to be able to see their health related information. And along with that, they'll also be able to communicate with the practice by sending messages, receiving messages, and also other details. Now, there has been a lot of requests that were coming in to make it a little more better in terms of appearance and functions. So I'll display what are all the things that we have gone over now. As you guys can see, items demonstrated today. First thing is under usability. In under usability, the first thing that we are going over is continuous conversation threading. So the goal of that is when a patient sends out a message to the practice and when the practice replies back, it should be in a continuous thread. Earlier, it was in two different, it would create two different encounters or two different messages altogether. But we are making sure to redesign it in such a way that when there is that back and forth, it is always available in one single thread so that you don't have to elsewhere in order to understand what the last conversation was about. So it will also, there are also things where we are restricting reply on older messages. So there will be a date, number of days that would be set, after which you cannot go back to an old message and reply to it. A custom disclaimer in which it will be a pop-up to the patient. If there is anything that the practice needs to convey to the patient, that can be also customized, and also click reducer. So there will be only 5 clicks in which 2 is to find and open the previous message, and 3 is to open the thread, reply, and finish. So I'll show you what it's going to look like. So here in the patient portal feature settings, we'll have a new option which is going to say restrict e-message conversation thread after certain number of days, which you get to decide from 5 in multiples of 5 until 30. Now what it's going to do is after that set date, if let's say if you set it to 30, after 30 days of the last response, maybe by the patient or by the practice, it's going to say reply to this old message thread is not allowed. Please compose a new message for further assistance. So it's just going to stop them from continuing the same thread. And also next one is display custom disclaimer on the patient e-message. That is when a patient wants to send out an e-message to the practice, when they click on compose, it's going to give them a custom error or custom message, which you get to decide. Here for an example, it says, please use messages for non-urgent communication only, but for anything urgent, please contact 911, something like that. Now when the patient clicks on compose, it's going to show that message right here. Then even during the reply option, when the patient clicks on reply, the message is going to be still there under the reply option. And then, like I said, the conversation threading. So this currently is in place, but the way it looks like is it's going to be all in the right side of the screen, where it's going to display the time, date, and the message. Just below that, it's going to show the other response, the time, date, and the message. So it's a little confusing to understand which was the last message, who sent it, all those things. So here it will be color coded so that it's easier to understand which side the message is coming from, and to understand when was it sent, in terms of time and date. Now these three things, what I just mentioned, will be available starting from 12.0.3. We are currently in 12.0.2, 0.04, but starting from 12.0.3, you'll be able to see this new updates. Now, along with that, we also had a lot of requests wherein the practice wanted the patients to be able to send documents through patient portal. Now, the practices were able to send out documents through patient portal to the patients from the beginning, but there was no other way around. So now we are also coming up with a feature wherein the patient can send out a document to the practice. The number of documents can be 5 documents. Each document should not exceed more than 5 MB, and also it should be either a PDF, a JPEG, or a PNG. Now it's going to be available under the web encounter, under the T Jelly and also it will be available in D Jelly and patient documents. Now the clicks are going to be 2 clicks in order to download and 3 clicks to upload it to patient portal. So even for that, the option will be available from the feature settings. We'll have an option that says enable patient to attach documents to the message sent from the portal. Once this is set to yes, the patient will have that option, which I'll show you now. Yeah. When the patient clicks on compose new message or this compose option, at the bottom we have an attach option where you get to select from the local file and attach up to 5 documents. So once it's sent, once it's sent, it's going to look something like this. Along with the message, it is going to show you that there is an attachment. Only once you click on it, you'll be able to see it. Also, you will have this paperclip option in order to understand that there is a attachment along with that particular message. So once you click on that, you get to see that there are attachments for you to view. Similarly, you'll also be able to see what those pictures are. Now this is in the D Jelly Bean. So in the D Jelly Bean as well, it's going to show you if there is any attachment. It's going to have the description that says portal patient uploaded documents to make it easier for you to understand where is that document coming from. And also from the patient documents, it's going to be saved in that as and there as well, from which you'll be able to mark it as reviewed. This is eClinical Touch. Even in the eClinical Touch, you'll be able to access the pictures that is sent by the patient. But from eClinical Mobile, you'll not be able to see it. Since the pictures are sent in a different format, it's currently not compatible with eClinical Mobile as of now. It's going to say that there is an attachment, but it cannot be viewed from the screen or from here. So even that is available starting from 12.0.3. Then the next one is allowing the patient to self SMS text enable and verify email from patient portal without practice intervention. Now this is from this, the patient will be able to messenger enable themselves for text. They will be able to update their cell phone number if there is any changes that needs to be made. And since there are two fields, home phone and cell phone fields, they can choose which number they would prefer to get that message for. And even the email, they will be able to verify their email from the patient portal. And there is nothing that the practice needs to do for this. Even in the feature settings, we have an option that says allow patients to enable SMS text notification from portal, meaning messenger enabling them from portal. And you can show pop-up to prompt patients to sign in for SMS email notification after they log in. Now this is mainly to prompt the patient, since we would want them to receive their appointment reminders or any kind of notification reminders that you'd be sending out. If it's a pop-up on the screen, it's very likely that they're going to click on it and enable themselves. It's going to look something like this. Right on the home screen, they're going to have an enable notifications option. Once they click on that, they're going to get these numbers. So it says cell and home. If there is any changes that needs to be made in terms of selecting the number, they can do that. By selecting the pencil icon, they will also be able to update that number, and they can messenger enable themselves or text enable themselves. They're going to receive a code, one-time password. They have to enter the code and click on accept. Now this consent form will also be available on the patient documents for you to always have it as a confirmation from the patient side that they are willing to receive these notifications, so that even in the future, if the patient says, I never signed up for this, I didn't want this or anything like that, you'll be able to go back to the patient documents and refer to this. Similarly, they will also be able to authenticate their email or verify their email address in order to receive any appointment reminders or any kind of email notifications that we have enabled through portal. What they have to do is, wait, I'll show that to you. Click on verify email, then select send verification email. And on the email, all you have to do is just click on verify email. So it will give you that confirmation that email is verified and notifications are enabled. So it's the same thing once it is done. Yeah. So this feature, what we discussed, is already available on 12.0.2. So there is, if you are already on the latest version of the EMR, the patient should be able to see it. If not, you will have to enable it in order for the patient to see it. Next, usability changes as to how the capture data from patient portal consent form is to be displayed meaningfully to practice. Meaning, when the patient accepts a consent form, how should it be displayed on the patient documents? It's a pretty simple one. All it's going to show is, it's going to say electronically accepted by whoever was the patient who accepted that particular consent form, and also the correct date format: weekday, month, date, year, and time. So I'll show you how it's going to look like. It's going to say electronically accepted by the patient name, and also consent date. It's going to say all these information. So it's just a simple upgrade or simple changes which is already available with 12.0.2. So we went over all the ones that is mentioned, which is usability specific. Next, we'll also go over regulatory one, which is Cures Act regulatory changes to test results. So in this, what it means is, in the lab settings, we have lab received notification. So when the lab is received by the practice, not necessarily reviewed by the provider, as soon as it is marked as received by the practice, it will be available for the patient on portal. That's what it says, lab published to patient portal as they're marked as received. And it will also notify the patient via SMS, portal, and email. And it's already available with 12.0.2. So as you can see here, by selecting this checkbox, lab DI results will be available on portal and Hilo as soon as it's marked as received prior to provider review. And once you select this, you cannot unselect. And even with this I option, you'll be able to see that per Cures Act, it is considered as information blocking if you're not publishing it right away. That's the reason. Once you opt in, you cannot opt out. It's hard coded. And it will also give a notification or a disclaimer on the patient portal that the labs that are available below, some of them may not have been reviewed by the provider still. So when they open one of the labs, they will be able to know this test is yet to be reviewed by the provider. So the regulatory is also done. Next, we'll go over specialty ones. The first one is support ASC questionnaires. The support ASC questionnaire means you are now with 12.0.2, you will be able to create a set of questionnaire which will mainly or only work with ASC modules. And those questionnaire, you can map it to a particular visit type and then have the patient answer it. So when you go to menu, EMR, and questionnaire designer, you're going to end up in the screen that you see behind. And when you click on create new, you're going to see the create questionnaire option. In this, you'll have to provide the name. Description is not mandatory, but you can provide that. And you'll have to select the checkbox that says ASC questionnaire. Once you click on create, you'll be able to create the questionnaire with preoperative details and past medical history. And when you get to the questionnaire settings within the patient portal settings, you have an option of changing it to ambulatory service. So in this, select it here and select the procedure type. You can also select provider and facility up to your practice, but selecting procedure type is mandatory. Once you have that, you can select the questionnaire and click on save mapping. So once this is done, it will be available for the patient to answer in patient portal, kiosk check-in, Hilo check-in. So even in the kiosk, you'll have the same view to map a questionnaire, even in the Hilo check-in. You don't have to necessarily map it 3 times. If you map it in one location or one module, maybe patient portal or kiosk or Hilo check-in, it will be available on all 3 products. Next, allow patients to access vision prescription on patient portal once published from the EMR. So that is, vision appointments has the prescription or contact details. If a vision appointment has the prescription or the contact details, that will be made available on the patient portal. So this is also the patient just accessing it. I'll show you what it's going to look like. So if you have a vision prescription, it will be available under the medical records, and it's going to even have a widget where the patient can click on and see their existing prescription that is added by the provider. Next, questionnaire specific to Bright Futures, and it will have the logo of the practice below. Meaning Bright Futures is a pediatric group which has a specific set of questionnaire for pediatric patients. Now that set of questionnaires will be made available from 12.0.3 on the EMR, which the patient can answer either from patient portal, Hilo check-in, or kiosk. This is completely free of cost, so any practice will be able to use it, not necessarily only a pediatric specialty practice. So once you map it, it's going to show the questions, and also at the bottom, it's going to show it's from American Academy of Pediatrics. This is from Hilo check-in, and this is from the kiosk. Now the patients will also see a common UI user interface for Hilo payment services on patient portal that has card on file. So let me show you how it's going to look like. So this means for copay or balance, the UI is going to be same, where the patient can either pay the full amount or even pay a different amount, meaning partial payments. It will also have the card on file option. Any saved card will be available for the patient to use in the future. So this is the common UI. When you get to if you're doing it from maybe, let's say, Hero check-in or from your cell phone, you will have an option of Apple Pay as well. Along with card on file, along with paying a different amount, you'll also have a Apple Pay, provided they have an Apple Pay wallet in that particular cell phone. The patients will be able to make the payment through Apple Pay. And it is also available from version 12.0.2, meaning it's already available as of now. So these are all the enhancements that are coming up and that are already available on the patient portal. Any questions regarding this?
Looking here, I don't see anything in the chat.
Sure.
I have a question.
Oh,
Yes.
go ahead.
It's Rachel. I know, shocking. I have a question. For the payments for the Hilo Pay, is this only if you already have Hilo Pay, or is this for everybody?
This is only if you are enrolled with Hilo Payment Services.
Okay, and if we do have Hilo Pay, is there something we need to do to turn this feature on? Like, so we don't store a credit card on file at our practice, but that, I guess this sort of replaces that, right?
Correct, exactly. So this one, you just have to make sure that you're on 6.1-6. So if you're unsure, all you have to do is just create a ticket saying, I want to be on the latest e-payment version. And if you're on 12.0.2, then the patients will be able to see all these options, the card on file and Apple Pay.
Perfect, thank you.
No problem. Any other questions?
I've kind of like oh, you're writing it out. How to map, someone wrote.
How to map. Okay, I believe that would be referring to, let's see. Yeah, this one. So mapping a questionnaire is basically just linking a questionnaire to any visit type. So for that, all you have to do is go to Hilo. And the third option is going to be Hilo check-in settings. So in that, the third option will be questionnaire settings. So once you click on this, you will have an option at the top that says create new mapping. Click on that, and then you can either link it to a provider level as well, facility level as well, but these are not mandatory. Then when you get to the questionnaire type option, select ambulatory service ASC, or if it is not ambulatory practice, then you can go with general as well. So after this, select either ASC procedure type, or if you're in general, it's going to say visit type. So you'll have to select that, and then you'll be able to see all the questionnaire. So for ambulatory service, the ones that are marked as ASC questionnaire here, only those will show up. Only those will show up. For general, all the other questionnaire that we see behind here, all these will show up if you go under general. Then select the questionnaire. You don't have to select just one. You can select multiple questionnaire as much as you want. And once after selected, click on save mapping. That's it. So does that answer the question?
We'll see if they type a response. For people on the call, what are some real life examples of when you could use this questionnaire mapping? Like, has anybody been thinking of it while he's presenting?
So was that a question for me? Sorry.
I was just kind of seeing if anybody was
Okay.
thinking about what they would map.
Okay. Yeah. This is mainly for patient health history. So if you
Okay.
have any paper, if you are currently using a paper wherein the patient will have to just tick on few things, and after that, that needs to be manually, imported in, added into the progress note. With this, the patient will be able to do it at their comfort of their home, maybe through patient portal or Helo check-in.
Okay.
And that is going to be available in the progress note. So all the provider would have to do is just click on one button that says import. So it's going to import or download all the patient response into the progress note. So it's a little bit, it makes it a lot easier. And since Helo check-in is always part of the contract, there won't be any additional charges to use this. And through Helo check-in, the patients will also be able to answer the questionnaire.
Okay. And then what are some examples of the forms or the actual documents that people could upload? The first thing you talked about?
Oh, hold on. Let's see. Oh, this one, isn't it?
Yeah.
The patient being able to send documents.
Yeah.
So usually, maybe during if it's a televisit, or if they find a rash or something like that. Usually the provider and let's say a patient has done any kind of labs or DI from another practice. Now
Okay.
this provider would want access to that. Obviously, it would take a long time for this provider to contact the facility and get that labs transferred. So if a patient already has it, all they have to do is just take a picture, and rather than sending out as an email, they can send it through the patient portal. So if you send it as an email, it has to be downloaded, then manually put into that patient's patient documents. But if they send it through the patient portal, it will automatically go into the patient document for the provider to see. So it will always, it's on use basis. When there is a necessity where the patient needs to send out any document, they can use portal instead of any other medium.
Okay, that's cool.
And even within the entire patient portal is always free of cost as well. So to use any of the features that I mentioned, there won't be any charges.
Nice.
Yeah, no problem.
Okay, I don't see any more questions in the chat. Will you be able to share this slide deck or not until ECW days are over?
Yep, I think not until ECW days
Okay.
are over, but I'll check with Dhruv once if
Okay.
we can share it with you.
No worries. We appreciate you. Thank you for joining our call today. It was nice to meet you.
Sure, no problem at all. Thank you so much, all of you.
And if anybody needs anything, reach out. Happy to ask some more questions or link people
Yes.
up. And
Yeah.
have a good rest of your day.
Yes. Thank you all.
Thank you.
Thank you so much, everyone.